However, here I am today as a result of hard work, resilience, and persistence. So, if I make any grammatical errors and I fumble in the course of my presentation, you should please kindly remember Dr. Kani attended public schools. Health promotion is key to shaping the future of our health as Africans. The African continent is part of the world that bears the burden of virtually all sorts of morbidity and mortality as a result of preventable disease and health-related events of public health importance, the likes of malaria, measles, malnutrition, maternal mortality. But why is that so, you may ask, right? Yes, all the scaring and the tragic epidemiological and the statistical figures of diseases are skyrocketing in this region as a result of multifaceted problems, ranging from lack of health education, awareness, and sensitization, lack of funding to build and maintain health infrastructures, unaffordable health care for West Africans, and many more problems. But despite all the above mentioned problems, we Africans still believe medicine or medical profession is all about prescribing drugs, examining patients, or weaving patients into the theater for surgical procedures. But the reality is that the profession is also deeply concerned with preventing humans from coming down with diseases in the first place through health promotion. Let me digress a little and say a few words on health promotion. Health promotion is the process of enabling people to increase control over and improve their health. So, if that is the case, by looking at the economy of African continent and the financial predicaments we are all going through as Africans, why would we subscribe to the idea of preventing ourselves from contracting the disease than coming down with diseases we cannot afford to buy medication to cure? Let me share a story with you. I was on board one day when a pregnant woman that was about to die presented with a complaint of labor-like pain, headache, and fever for almost 3 days straight. She looked tired, exhausted, and in very obvious painful distress. After taking a very short history and examination, I found out that she was truly in labor, but unfortunately, she could not deliver by herself because the baby was too big, a condition we call macrosomia. But you know what? This young pregnant woman had never been to antenatal care throughout the intense pregnancy. It means she should expect the unexpected. And there wasn't anything like bad preparedness and complication readiness because we had never been to ANC. I had to call my head of department to inform her that we have a place or we have another place that's having a financial predicament. And she directed me to attend to them without asking them to go and pay a single call. With the intention, they will settle the bill after the procedure. So in our commitment to save her life, we quickly booked her for an emergency cesarean section. But unfortunately, the husband and the family did not agree. Because they were still optimistic she won't deliver herself. We had to call one of our colleagues that happens to be a religious leader and as well a medical professional to preach and convince them to heed our medical advice. Surprisingly, he spent almost over an hour before he finally convinced them. He spent almost over an hour before he finally convinced them. After they have agreed to sign the consent form, we prepare and wheel her into the operating room, and God so kind, we finally set the baby and the mother as well. But what are the moral lessons of the story? First, the patient, husband, and the entire family lack any knowledge that will enable them to increase control over and improve their health. How on earth would a woman be pregnant and reach the time of delivery without attending her antenatal care? It is only through antenatal care as a pregnant woman you will be able to understand the concept of danger signs of pregnancy, prophylactic and preventive measures against malaria while pregnant. At that point in time, healthcare workers will be able to identify what we call high-risk pregnancy. It means the pregnancies that need our special care and attention. From the story, we have heard how a religious leader played a vital role in trying to convince them to give our medical advice. It means traditional rulers, or we can say religious leaders, play an important role in making decisions concerning the health of an African man. Lastly, if not because of our kind intervention, this woman could have been added to the number of maternal mortality we are always recording in Africa as a result of our lackadaisical attitudes that could be attributed to lack of health education, advocacy, and promotion. We can prevent millions of health problems by simply accepting the reality of health promotion. This is not only possible, but achievable through what I coin as 5 R's of health promotion. If you like, you can call it Dr. Kani's 5 R's of health promotion. Reorient, recreate, redevelop, restrengthen, and finally rebuild. Reorient. We need to continuously orient Africans on the importance to be of seeking health advice, whether well or sick. It should not be till when you are sick to helter-skelter start looking or asking for health advice. Right? Secondly, recreate. We must put our hands together to create a supportive environment and society. This is possible by eliminating harmful traditional practices, the likes of female genital mutilation. Strong women should give birth at home, euthanasia. All these are harmful traditional practices that are well entrenched in our respective communities that we must do everything humanly possible to eliminate them. Redevelop. Let's develop personal skills that will enable us to understand the pertinent health information to take the necessary steps by knowing what could cause illness. So, individuals can be proactive in monitoring or supporting their health. For example, using insecticide-treated mosquito net can prevent you from malaria. Human papilloma virus causes cervical cancer. Madam, how can you protect yourself from the effects of human papilloma virus? By simply receiving your vaccine. These are basic information each and every one of us should have. And not made, or the information is not made for healthcare workers alone. Restrenthen. We can actualize this step by encouraging community participation and action, developing support groups, those with same health concerns who can bind together to advocate for policy changes. For example, people living with HIV, sickle cell disease, hypertension, diabetes mellitus, bipolar disorders, and so on and so forth. they can come together, converge together to advocate for themselves and do away with any form of stigmatization. Rebuild by building health-related projects or activities by the government can increase awareness, provide resources, and boost people's knowledge to take control of their health. All the above-mentioned strategies, we have practically applied them in different regions and found them to be effective. It was in 2020 when the United Nations nominated our campaign Nigerian Against Coronavirus as one of the 10 youth campaigns that are working fervently against the spread of COVID-19. We have educated people in rural communities on the preventive measures, signs, and symptoms of COVID-19 by using mass media, social media, door-to-door campaign, town criers. And we have reached out to not less than 25,000 individuals, excluding mass media and social media campaign. To cut the story short, the outcome of our campaign was so amazing, which we believe it was one of the driving forces that led to a drastic reduction in the number of COVID-19 cases in Kano State, which was also attested by the relevant stakeholders, e.g., Kano State government. This is the power of health promotion. Finally, let me conclude by saying, being a medical doctor and a health advocate as well, I am very enthusiastic about reducing the burden of obesity and mortality on the African continent through health promotion. But this work is not meant for healthcare workers alone, but for all of us Africa and also at the global stage. Join us in the movement, and together we can make it to push and shape the future. Thank you.